Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of three. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, strong moms. You're in the right place. Hello, strong moms, and welcome back to Every Mom is an Athlete. Today, we are doing part 2 of our pregnancy pain series, and we're going to talk about pubic symphysis pain, or SPD, symphysis pubic dysfunction. So this is more common than people realize, actually. I think often I get women coming into my office, and they're like really freaked out by this because it's just like a pain that most people haven't felt before they're pregnant. And so they're really freaked out by it. It's so tender to the touch, but there is so much that we can do. So you've heard me say it before, but pain during pregnancy is not normal. Even if it's common, it's not normal. You shouldn't just deal with it or put up with it. I just go crazy when I hear patients in my office say that they talked to their OB and they were told basically to just like, well, you're pregnant. That's part of the deal. Like, no, there's so many answers. So today we're going to talk about things that you can do and not necessarily just like stop doing this movement or avoid this movement. There's a lot that we can do to actually reduce the pain. And when we understand why and how it happens, we can make modifications. So let's get right into it. So the symphysis pubis is actually a joint. So it's right down at the center of your crotch, basically, okay? And it does connect the back to the front. So in the back, you have your little triangle-shaped sacrum. Then you have the two big bones on either side, and those are like your sits bones, okay? Just kind of in layman's terms. And that wraps all the way around your actual hip, like your femur attaches in, and then the pubis is where it connects in the front. And the thing is, it's a really small joint. And what a lot of people don't realize is that your abdominal muscles actually connect right into that joint, okay? So you can imagine when you think about that, as your abdomen is growing during pregnancy and that the tendon of those muscles is attached to this little tiny bone, that you can understand why it might start to get kind of pulled on and there can be a lot of tension and pain through there, especially if your pelvis is rotated or something else is going on. So why does it show up? As I just mentioned, especially if your belly grows quickly, like if you're in, like for me in my third pregnancy, I was like, whoa, this thing is huge. But that can just cause more pulling, just like anything, right? Anytime that a muscle is going to like just stretch a lot, that can pull on the tendon that it attaches into the bone. We have to remember, just as like almost all these pains during pregnancy, there is some hormonal component. Once we're pregnant and we have relaxin in our system, it's great. Like that's how our pelvis is going to spread to get the baby out, right? We need it. But it also does cause things to start moving and pulling in a way that can just cause some discomfort. Sometimes with SPD or symphysis pubis dysfunction, one of the reasons is that your hips can be rotated. So imagine, those two big bones on the side of your hips. If one is rotated forward and one is rotated back a little bit, you can imagine that the hip that's rotated forward can be pulling a little more in the front. The hip that is rotated back could be kind of like that glute could be pulling a lot. And so that joint dysfunction of the entire pelvis can sometimes cause pain in the front, in that pubic bone. So what makes it worse? Like what are we doing that can make it worse during pregnancy? So what I see a lot are single-sided movements, okay? So standing on one leg to put on your pants, going up the stairs, getting in and out of the car is what I hear really commonly from patients in my office. Also like wide stance movements. So if you're deadlifting like a sumo stance deadlift where your legs are out really wide. I remember during my third pregnancy, actually, I did some sumo deadlifts and the next day I was like, holy moly, I can barely walk. And it was from that. It was just too much of those inner thigh muscles that are just like stretched in that movement, pulling on this tiny little pubic bone. So that can be something that's irritating it too. Again, not necessarily for everyone, but if you're having this issue, if you're having pubic bone pain, that could be one thing to cut out for the time being because it could be irritating it. Sometimes I hear from people that rolling over in bed at night can flare it up or cause pain, and also really aggressive stretching. So I don't generally recommend doing a lot of stretching during pregnancy. And that might sound kind of crazy, but you have to think about what's going on again with the relaxin, with the hormones in your body causing stretching and pulling on all these ligaments and tendons. So what I recommend more than static stretching would be either a dynamic stretch where you're not really like getting to that very end range and you're just kind of trying to move the joints through ranges of motion, or foam rolling, because then you're actually getting into specific spots that are feeling tight. On the last episode, if you want to listen to it, we talked about sciatic pain and I brought up foam rolling. So if you're having sciatic pain on your right side, you would cross that right leg over in a figure four. You would roll your body slightly more weight onto the foam roller on that right side. And then you would spend a couple minutes just rolling up and down there. And that's going to specifically hit that tight spot in the glute instead of like stressing and straining and pulling on the whole muscle, which again can irritate the joint, especially during pregnancy. Now, if you're looking online for solutions for this, what do I see? What do I hear from patients that they've been told? Either one, there's nothing you can do. This is a normal part of pregnancy. False. Don't ever believe that. Okay. There's always something you can do. There's always a chiropractor or a physical therapist or even a massage therapist that could probably help you with some of these issues. So don't do nothing. Okay. Don't just live in pain. It just like tears up my heart when pregnant women just like have so much pain through their pregnancy and they're miserable. You should be able to enjoy most of your pregnancy. Okay. Obviously there's some rough parts, but like I really truly want you to enjoy your pregnancy. The second thing I hear often is ice the pubic bone. That can help. That can be relieving. But generally, ice is really only effective the first few days of an injury, okay? And this is more of a repetitive use thing. So I always just tell people if something sounds like it's going to feel good, like ice or heat, if your like body is telling you that it needs that, you can try that and see how it does. Try 10 minutes of icing. Don't just stick ice right on your pubic bone, okay? Obviously have a barrier between it. And that can be relieving, but it's not necessarily fixing the problem. So I don't love that advice as much either. So let's talk about what actually can help. So when women come into my office with pubic bone pain, the first thing we're going to do is check their hip alignment. What that means is, are your hips both moving equally? Are they aligned? And if you can, I always recommend getting into a Webster certified chiropractor. They're just going to treat your pelvis a little bit more gently. They're going to make sure that your pelvis is in good alignment so the baby has room to get into a head down position. And it can also just help a lot with low back pain, pelvic pain, all this stuff. So that's number one. Number two, and I mentioned this again in my last episode, but if you need help at home and you can't get to a Webster chiropractor, I do have a pelvic pain fix plan. It does go through all this stuff. It helps you align your pelvis at home. It helps with pubic bone pain, sciatica, low back pain, round ligament pain, all the stuff that we're going to talk about in these episodes. There's a whole plan that basically walks you through it. It's like, here's how you align your pelvis. Here's the stretching you should do. Here's the strengthening you should do. Here's the foam rolling, like all that stuff. It's like written out like for each specific issue. So you could definitely check that out. But I do recommend you've got to make sure that that pelvis is aligned, because if it's not, then you're sort of just banging your head against the wall and you're not getting to the root of the problem. Now, if your pelvis is in nice alignment, that's when we start looking at other things. Now, the adductors, those inner thighs, can really pull on the pubic bone, but stretching them, I promise you, will almost always make it worse. So I don't recommend stretching them. I do recommend foam rolling. I talk more about how to do that without causing pain in my plan, but that is one thing that can be really helpful, is decreasing the tension in those adductors, those inner thigh muscles. There's also a brace that I find especially effective for my patients who are having symphysis pubic pain. It's called a Sorolla brace. I'll put a link below for one that I really like. You don't need to spend a lot of money on this, and it's not like the big brace that goes around your belly. It goes actually around your hips, around your pelvis. And what it's going to do is it just causes some forced stability there. So it's going to take some pressure off of the pelvis and just give you a little bit of support. And so I find with patients that have pubic bone pain, this can be especially helpful if you're going for walks. Like, you don't wear this if you're just like sitting at your desk. It's going to be pretty uncomfortable. But if you're going out for walks, if you're on your feet a lot, this can be one way that you get some support. And it's a tool, right? Like, we're not going to use this forever, but it can be really relieving for, especially like I said, being on your feet a lot, walking a lot. That can be something that either a chiropractor or a physical therapist can help you figure out if that's a good fit for you. Or sometimes when I have consults online, I'll have people either kind of press their hips together like grab your hips both at the side and kind of press together. And if that feels better, you can have your partner do that. If that feels better, that could be a good sign that support of the belt could be helpful for you. Or you could always try it, right? Like you can buy one of these for $20 or $30. You can try it and see if it helps. If it doesn't, well, then, here we are. You lost $20 or $30. But if it helps, it can be like a complete game changer. Also, while it's flared up, I usually recommend my patients kind of reduce any movements that cause a lot of asymmetry in the pelvis. So sit down to put your pants on, like maybe you decrease lunges or single leg deadlifts or stuff like that you might be doing that could be really irritating that pubic bone. And it doesn't necessarily mean it's for your whole pregnancy. It's definitely not forever, but like it can just help decrease having all that body weight on one side of your leg, on one side of that small little pubic bone that's stabilizing your pelvis. And of course, I can't not mention the fact that you need to be doing core work, right? Like when you are having any sort of low back, hip, pelvic, any kind of pain during pregnancy, I always revert back to core work because so many of us just kind of like let that go during pregnancy. We don't have time, or we're tired, or we don't feel well, or we've been told not to do it. But truly, when you stabilize through your core, you're going to be able to eliminate some of that pain. You have to remember, like, everything is moving and like starting to loosen. And so all we really have to stabilize, besides like a brace if we use it, but are our muscles. And we want to be using those muscles to strengthen our core, to be able to keep things in as good a position and posture as possible. So what does that look like? Obviously, you're not doing crunches, right? That's the number one thing during pregnancy that I'm like, listen, stop doing crunches, okay? There's so many better core workouts that you can do other than crunches in general, but especially during pregnancy. Also, I usually have people eliminate things like hanging from the bar. If you're like hanging from a rig in a CrossFit gym or something like that, it's just a lot of pressure through the core that most women cannot control, especially as we get farther along in pregnancy. So what are we doing? Some women can do planks pretty far into their pregnancy. If you can, great. If you can do them from your knees, great. Most women can do side planks from their knees without having any coning or doming in their abdomen. That's a great one. I love Palloff presses. I love any of the transverse abdominis engagement. So if you see online, women doing those like belly pumps where they like kind of suck the baby in, they're using their transverse abdominis. So that's a great one to do, especially as you get further along in your pregnancy. I love carries for pregnancy. So farmer's carries, suitcase carries, overhead carries, all that kind of stuff. It is a great way just to make sure that you're supporting your spine and stabilizing your core using all the muscles that you should be using. Again, if you've heard me talk at all, I have a pregnancy core plan. And I think I mentioned this in the last episode, but I think that if you go to buy my Prego Core, you actually get a discount on that pelvic pain fix and vice versa. So let me know if you're interested in those at all. They'll be in the show notes. One other thing you can do to help that I sometimes have patients do at home is basically do some massage right above your pubic bone, because that is where that tendon is. So you can get a little lotion, do a little massage there. You can do a little gua sha on it if you're familiar with that, but get that tissue moving a little bit, because that can really help some of the pulling into the pubic bone, not right on the bone, but just right above. Okay, so when do you need more help? So if your pain is getting worse and worse, like week over week, and especially if you're trying some of this stuff and it's really not helping, that is a time to for sure get help. Talk to your doctor, try to find a chiropractor or a pelvic floor PT, someone that can help you actually make some physical changes. If you're having difficulty just walking, or if your sleep is really disrupted, or just your daily functions are affected, again, reason to get help and try to make some changes and make some improvements with this. All right, so I hope that is helpful. What I really want you to know is that symphysis pubic dysfunction is common. It's not normal. There's a lot that you can do to help with it, but it is common. I do see it in my practice quite a bit for all the reasons we've talked about. So give some of these things a try. If you still need more help, of course, click the link below. You can learn more about my plan to do at home. And if you have a pregnant friend that you know is dealing with some of these aches and pains, I would just so appreciate you sending her the episode. Next week, we're going to be talking about rib pain, another super common thing that I see in pregnancy. But until then, strong moms, have a great week.
Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review.
It helps more moms find the support and information they need. See you next time.